Welcome everybody, my name is Felix Herth. I'm working in the thorax clinic in Heidelberg, and I want to talk with you about the advances of the InterVapor technology for our patients suffering on emphysema. How many patients we have to think about? And when you go through the different literature which is published, we have to accept that we have millions of patients suffering on COPD. Everybody is agreeing that we have to split them up in different classes. And we have a technology which maybe works in stage 4 and in a special subset of stage 3 patients. And when you look to the numbers of that, for sure we have millions of patients which suffering on an end-stage disease, and we have to look for help. Because all of the patients are on inhalers. A lot of patients are on long-term oxygen therapy, but still they are knocking on your door and they are complaining shortness of breath and reduced quality of life. So what is the standard of care for our emphysema patients? For sure, most of the patients smoke, so smoking cessation programs are the most important part. But to be honest, when I look back to my patients, most of the patients stopped smoking because they are so short of breath that they can inhale a cigarette. So after stopping that, rehabilitation programs, doing exercise tests is very helpful for our patients, but also there. Our patients with end-stage emphysema cannot walk a lot. So exercise is limited by their capacities. All of the patients are on inhalers, and maybe a handful of patients have the chance to undergo a lung transplantation. But there, worldwide, the limitation to have access to a new lung is 60, and most of my patients are older than 60. So lung transplantation is no longer no opportunity. So we worked a lot in the past to develop technologies to reduce the hyperinflation of the patients. And there are different techniques available. We have the valves for that, which works in a well-established but small subgroup. And we also have the InterVapor technology, which might be as an option we can offer to more patients than we can use maybe the valves for. So what we are doing with the vapor, at least we apply thermal energy. This creates a process that the lung is remodeled. There is a creation of scar formation, and scar leads to a shrinking process. So by that shrinking process, we are able to reduce the lung volume of the treated lobe, and therefore the patient should show the benefit. So what we're doing, we are trying to reduce the local volume, and by reducing that local volume, hopefully we can help our patients. So how is the procedure ongoing? It's quite an easy procedure. What we need at least the lung function showing us it's an end-stage emphysema patient. We need a CT scan showing there is a target. There are areas of the lung which are really severely destroyed, and there are areas which are compressed by the severity destruction of that destroyed lobe. What you need the technology, you need the support of the company, so you need the machine, the generator, you need, and it's a fancy technique, you need an iPad, and the iPad shows you exactly where you should place your catheter and how much of the energy you should apply. So you get a perfectly detailed procedure plan by the help of that technology. So what it means for the patient flow. So the patient is coming for the first time in your office, you do the lung function, you do the CT scans, and you discuss with the patient the opportunity. When you decide, okay, based on the lung function, based on the CD distribution of the emphysema, the patient is a candidate, you submit the CT data to the company, and the company come back within a couple of hours with a treatment plan, where you exactly see where to place the catheter, how long to apply the energy, and then you can fix the date where the patient is coming into your endoscopic unit, you heat up the machine, and you do the procedure. Going through step by step through the procedure. You have the treatment plan. You decide where you can place anatomically the catheter. Can you place it on a segmental level, on a subsegmental level? Depending to the area where you can place the balloon catheter, the machine gives you the signal how long and how much energy you have to apply. Then you go in, you fill in the balloon, that you have a closed system, then you press the button and the energy is delivered. Quick procedure, not really complicated. And the system helps you a lot that you can be sure you are treating the right subsegments.